Hi, my name is Dr. Nancy Holekamp. I am Director of Retina Services at the Pepose Vision Institute in St. Louis, Missouri, in the United States. During EURETINA, I gave a presentation entitled Fluid in Neovascular AMD, a Pragmatic Approach. My take-home message was that it's very important to look at the fluid compartments when managing patients. For the last 15 years of anti-VEGF monotherapy, we have never really proven that being dry is better than being wet. In fact, early in my presentation, I showed an analysis of the VIEW clinical trial that showed at 6 months, the patients who were wet were doing just as well as the patients who were completely dry. So this caused us to look further into the fluid compartments, the impact of intraretinal fluid, subretinal fluid, and to a lesser extent, sub-RPE fluid. And what we found was that subretinal fluid was not damaging to vision and could possibly be tolerated during treatment for wet AMD. And in this regard, we could balance the treatment burden with the overall visual acuity improvement. In fact, when you look at subretinal fluid, eyes with persistent foveal or non-foveal subretinal fluid actually had better visual acuity outcomes than eyes that were completely dry. Now, when we look at intraretinal fluid is very damaging to vision, and eyes with persistent intraretinal fluid were prone to a worse visual acuity outcomes than eyes that were completely dry. Now, we looked at this through multiple post-hoc analyses. I was involved in a Harbor post-hoc analyses, but we see this with VIEW clinical trial analyses, Altair clinical trial analyses, Aries clinical trial analyses. All of those were post-hoc analyses. But there's also a prospective clinical trial called the Fluid Study, which reinforces this notion that subretinal fluid doesn't have to be treated aggressively, and that we can manage patients and hopefully extend the treatment interval and thereby decrease the treatment burden and still get excellent visual acuity outcomes. Thank you.